So our wildlife clinic was presented with a young adult grey-headed flying fox, and it's a male. And grey-headed flying foxes are one of 4 species of flying fox extant in Australia. They're a little bit unusual around here. The more common species that we see through our wildlife clinic are little red flying foxes. They're the species that Dubbo residents will be familiar with, flying out in huge numbers. But there is a small colony of grey-headed flying foxes, I think down near Wellington. And so this guy was encountered in the centre of Dubbo. On Darling Street, so he's obviously flown up from his roost and got into trouble. So a member of the public picked him up or noticed him and then contacted Wires, and a Wires rescuer travelled out and picked him up. And it was obvious to the carer that there was some very severe and extensive wing injuries. Obviously flying foxes have evolved a capacity for flight. They've got very complex wings which are comprised of thin sort of elastic membranous skin that's spread between their very elongate finger bones and arm bones, and it's a really handy structure that enables them to fly, but it's very vulnerable to damage. It's a very sensitive structure, particularly if the bat becomes entangled, and we see a lot of flying fox patients that have become entangled in barbed wire, and sometimes they get entangled in the netting that's used to protect fruit trees, and the bats get tangled up in the netting. The netting or the barbed wire twists up quite tight. It not only tears and lacerates the wings, but it also damages the blood supply. So even after the initial damage and lacerations have occurred, the wing often progressively deteriorates for a week or 2 afterwards, and as the effects of the damaged blood supply are manifest. And so that process is what we're managing with our grey-headed flying fox patient. He's got some very extensive injuries all over his body, but particularly lacerations to his wing membranes, and those lacerations and areas of damage are progressing and spreading and becoming larger. So while that happens, we're managing those wounds. We're treating him with medication to attempt to slow that sort of progressive necrotic process down, and we're cleaning and dressing his wing injuries so that healing soon establishes and progresses until he's releasable. He could be with us for a while. I mean, you're never quite sure exactly where you're going to end up with a flying fox wing injury. It sort of depends how badly it deteriorates before it turns the corner and starts getting better. It can take weeks or months for wing membrane deficits to eliminate infection and begin to heal and replace themselves, such that the animal's capable of flying. And look, sometimes irrespective of a long healing phase, the wing membrane is still not capable of supporting flight. I mean, those animals can't be released. So sometimes we progress these cases with our fingers crossed a little bit, but we're pretty confident with this bloke that he'll be releasable. His wing membranes are still largely intact. All of the margins of the flight membranes remain intact. So all of the little deficits and holes are really within the substance of the wing, and in those areas they usually heal. There are a few areas that we're quite worried about, particularly over his first digital finger bone, which forms part of the strut of his wing, and you will have noticed during the procedure that bone was quite exposed as the wing membrane deteriorated over the top of it. So we're particularly focusing our wound care on that area of damaged membrane over that bone.